Bismillahirrahmanirrahim. I'm Dr. Shoukat, the ENT consultant at Farooq Hospital. Today we are going to discuss a very important thing, that is a disease of ear that is known as wax or cerumen. A technical term is cerumen, and the normal people use the word wax for that. There are glands into the external auditory meatus or canal. They are known as ceruminous glands, which produce this wax, and they produce wax only when the water hits the external canal. So if the water does not hit the canal, the cerumen or the wax is not produced. Once it is produced, there are three symptoms which the patient complains of. First is the irritation. There's a lot of irritation, and there's urge of just scratching the external canal. That is irritation. Second thing is the pain. When it presses the nerves, there is pain. There is excruciating pain at times. Sometimes the pain is not that marked. And third is the blockage of ear, because the wax completely blocks air from entering the external canal, so there is blockage of ear. So there are three symptoms. First is irritation,
second is the pain, and the third is the blockage of fear.
And the third is the blockage of fear. When a patient with the wax comes, we have to decide about two things. First, is the wax very hard, not to be removed, or it is soft and it can easily be removed. If it is soft, it can be removed either by suction, or it can be removed either by suction, or we can use the wax just to remove it. If it is very hard, patient will feel a lot of pain, so we decide against removing it there and then, and we put some drops into the ear which soften the wax. After 4 to 5 days, when the wax is softened, we remove it by suction under the direct vision, so that the structures and the drum head is not injured, or it is not wounded, and we give the drops for 3-4 days, and the patient recovers. So the take home from this video is that whenever the water touches external canal, the cerumen or the wax will be produced. So avoid touching your water or anything else with the external auditory meatus or the external canal. You should be able to do two things. First, either plug it with the cotton and just Vaseline over it, so that when the water touches it, it just passes away. One thing is this, and the more scientific thing is using the earplugs, which we normally use when we go into water for swimming. So this is the takeaway from that. Thank you very much.